Welcome all to this session on pandemic security. We're going to focus on the critical role of scientific preparedness for pandemic prevention, which follows on one of Michael Bloomberg's themes on the importance of science and science preparedness and collaboration. I'm Bruce Gellin, Chief of Global Public Health Security at the Rockefeller Foundation, joining you virtually from Washington, D.C. Next slide, please. Failure to prevent this pandemic has caused an unprecedented human tragedy and economic loss. We've all seen these dismal statistics, and we're still in the middle of the pandemic. It's disrupted societies around the world and demonstrates the need for all regions to make global health security a priority. To that end, it has galvanized global momentum to strengthen and rapidly build scientific capacity to track the evolution of the virus, the variants we've heard so much about, as well as develop new diagnostics and new vaccines. Next, please. And while the urgency of the moment is COVID, there are numerous unknown and known emerging pathogens that have pandemic potential as well. Influenza, Ebola, Zika, antimicrobial resistance. Pick your favorite region or your favorite pathogen, and you'll see this is an issue that we're always going to face, and we face everywhere. And in addition to the pathogens we know, we must also be prepared for what has yet to be emerged, which is what we refer to as disease X. And we always challenge ourselves to try to think of what is the thing we don't know. Yet we need to learn from the current lesson of this pandemic to prevent future pandemics, and must continually challenge ourselves to ensure that we're looking with fresh eyes. Next. Earlier this year, the Rockefeller Foundation established the Pandemic Prevention Institute. It's committed to helping build a global early warning system that enables us to ensure that pathogens with pandemic potential are quickly detected. Our vision is to ensure that communities have that information and the tools that they need to be first responders and halt outbreaks before they spread. Our mantra: see the signal, speed the response, stop the spread of an outbreak. Next, please. Here's a snapshot of our next slide of our current partners. And partnerships matter. To be successful, we need a global network of scientists who can collaborate to identify emerging pathogens, understand disease dynamics, and rapidly share information to inform public health interventions and the development of medical countermeasures. We're already working to connect scientific institutions, public, private, academic, across Africa, Asia, and the Americas to track variants of the COVID virus, as well as build capacity to prevent future pandemics. National leadership and regional leadership is essential to sustain these networks of scientific preparedness beyond COVID. And our partnerships with scientific alliances in India and Thailand, from who you'll hear from shortly, highlight the need and power of coordination and collaboration in this response. And importantly, regional cooperation across countries is needed to ensure the continued role in disease surveillance across borders. We're working with institutions who have taken this leadership role, like the Africa CDC, the Pan American Health Organization in Latin America, as well as the World Health Organization and the global multilateral community through the Access to COVID-19 Accelerator, or ACT-A. Next slide. So we're here today to learn from the failures and build on the successes of responding to the COVID-19 pandemic, and build towards a future where national scientific capacity, regional coordination, and innovation ensures that we never have to live through another pandemic. Hence this call to action, which focuses on the key pillars of scientific preparedness: platforms for regional and global scientific coordination, peer learning, and data exchange. Networks of national public health scientific centers to drive research on local disease threats, the establishment of centers of excellence for the discovery and tracking of spillovers from the animal kingdom, the zoonotic diseases, and other high consequence pathogens to ensure that we identify emerging threats before they spread into the human population, and real-time data and analytics around the potential outbreaks so that information is shared rapidly equitably, and transparently around the globe. Next slide. And now we're really going to get started here. Our speakers, who you'll meet in a minute, are scientists and leaders within institutions that are pathfinders. Briefly, Dr. Thanat is head of the Mahidol University's Genomic and Evolutionary Medicine Unit, which hosts the COVID-19 Network Investigations Alliance in Thailand. Dr. Sofonias leads the Africa Center of Disease Control's Institute of Pathogen Genomics that links laboratories across the African continent. And Dr. Natasha Howard is an expert in infectious diseases, disease policy and control there in Singapore at the National University. So welcome. And for the audience, know that we'll be using the Q&A function, but we're unlikely to have time to answer all the questions, but please ask those questions and the team will get back to you and follow up with each of you. So let me stop speaking and introduce you to the speakers who really are going to tell you what they're up to, and starting with Dr. Thanat. Dr. Thanat, early in the pandemic, your network, the COVID-19 Network Investigations Alliance, came together to accelerate and sequence the SARS-CoV-2 samples in Thailand. Could you speak about the role of your alliance in supporting the public health communities in understanding the evolution of the pandemic and your priorities beyond COVID? Thanks.
Okay. Thank you, Bruce. And I would like to thank the organizer for having me here. So when the pandemic happened, I think things are not going as I wish it should be. So I work with my colleagues based in Thailand and a Thai scientist that work outside the country. We said, hey, we need help. And they came to help us. So we run the SARS-CoV-2 genomic surveillance in Thailand. I think our working principle is very easy. We do sequencing for free. All we ask is that once after we finish sequencing, we submit these data into the public database like NCBI or GIS8. And after that, we also make the next-strain build for data visualization for Thailand, for Southeast Asia. And the work has been ongoing. And I think we work a lot with the partners in the government, at the local hospitals. Perhaps I can share a story. So I think there's one day I think earlier this year, I got a call from my colleagues at the ministry around 10 p.m. He said that there's something not right about this market. It's called, it's a wet market at the outskirts of Bangkok called the Ponpat. And this place is close to the bus station next to the transportation hub to the northern part of Thailand. So if I can, basically it's like a market close to the port authority in New York. So if there's something spreading there, the chance of it getting spread is going to be pretty high. So I think what happened is that, so when we went, the thing about this market is that there were many outbreaks. The government tried to control it, but somehow there's a new cases keep coming up, and it was not possible to control it well. And I think that so when we look at the data, when we do perform the surveillance, it appears that it's not like that the virus from other places came to this market because it's close to the hub, but there seems to be the lingering population of the virus there. And what happened is there's workers at the markets that when the market was closed down, they felt like that, if they come out, the market cannot be open and they cannot work again. So they prefer to hide at home. And I think that was the problem. So we work with the local government to communicate with them that, hey, we want you to work again. We want the market to be open again. But it means that everyone had to come out. Everyone needs to be tested, to be quarantined. And that's what happened. I kind of like this story because it showed that I work on genome. I can do sequencing, but eventually it's up to the local health officials. It's up to the government to work together with the public to communicate. And I think at this point, I think we hopefully we are at the end of the COVID pandemic in a way. But one thing that I would like to encourage everyone to think is that we have this very important window here, that we don't want to squander the goodwill of the people, because now it's easy to ask people to cooperate, to think of how to implement genomic surveillance in their work. we could do better by integrating this kind of approach in many pathogens. Like TB, we can diagnose whether the patients have drug-resistant TB before the culture. We can use this to monitor multiple systems. And I think I would like to thank the Rockefeller Foundation as well for their support for us to continue and expand the work to other diseases. Okay, thank you, Bruce.
That's great. If I would just comment, that's such a wonderful story because it demonstrates so many features. In addition to the collaboration between your laboratory and the public health authorities and the public, it also shows, and particularly the recognition of having a pathogen near a bus station and the importance of data from a variety of different sources to be able to identify where things might happen. And then importantly, the roles of not only the integrated response, but the important role of communication. So thank you. It's a great story to start us off. But let me move to Dr. Sofonias, again, from the Africa CDC Institute for Pathogenomics. This was established prior to COVID-19 and was a pivotal in coordinating the surveillance efforts around the continent. Can you share some lessons that you've learned about connecting laboratory networks to strengthen public health surveillance across Africa, what that means not only for COVID, but what that means for other pathogens?
Thank you so much for the opportunity to share our experience in responding to the COVID-19 pandemic and in coordinating the continental pathogen genomic surveillance network. At the Africa CDC, the Institute of Pathogen Genomics actually predates the pandemic. It was launched in November of 2019. But 2 months later, we had the COVID-19 pandemic. So the first action for us was to respond to the COVID-19 pandemic. So just to give a highlight on where we started, Africa CDC as an institute, it was officially launched in 2017. But we early adopted genomics. We conducted for 2 years trying to understand what are the bottlenecks, the challenges, in terms of expanding pathogen genomics in the continent, specifically focusing on public health pathogen genomics. And we summarized our finding, 2 years of assessment, visit to 14 countries, 22 institutions, and plus a lot of virtual work that we conducted. We summarized our findings. In November 2019, the Institute was launched as a response to that finding and to respond to the challenge. Just a couple of months later, COVID-19 pandemic was reported. And next, please. We've been advocating for the expansion and acceleration of COVID-19 surveillance even before the discovery of variants. Since the beginning of the outbreak, we've been trying to support member states to expand genomic surveillance, because viruses, we've learned a lot from other viruses, they can definitely evolve. Next, please. So in October 2020, our effort trying to respond to the COVID-19 grew into a bigger collaboration and partnership, what we call the Africa Pathogen Genomics Initiative. This is really a partnership between philanthropy, public, and also the private sector, trying to respond to the major challenge that the continent have in terms of implementing public health pathogen genomics. Next, please. So based on our finding, what we found is very few number of labs in Africa have capacity, pathogen genomics capacity. So networking is critical. So what we did is we networked the continental labs, those with a higher capacity to be at the top, what we call specialized centers, those with some level of capacity, we call them regional labs, and then there are national level laboratories. So we try to network and use the existing capacity, leverage the existing capacity in the continent to respond to the COVID-19 pandemic while we are strengthening it in parallel. Next, please. So we set a target at Africa CDC to have 50,000 genomes by December of 2021. At that time, when we set this target, there were only about 4,000 sequences in Africa. Next slide, please. So as of today, we have reached more than 52,000. So that target has been achieved, but that's through partnerships, engagements. All the labs in the continent have put quite a lot of effort in expanding sequencing capacities. Several partners supported this directly to the labs or indirectly through the Africa CDC, Africa PGI initiative. Next slide, please. So in our approach, next please. In our approach, we had 3 strategies to achieve this 50,000 target. The first one is, next please, to leverage and strengthen existing capacity in the continent. In one or another way, and in research institutes or academic institutions, there is some capacity of genomics in the continent. So we wanted to leverage those capacities to support the COVID-19 response, and then while we are supporting and strengthening those capacities. Next, please. We also tried to expand and democratize sequencing in the continent. There are several laboratories that are ready to absorb this technology. So we conducted an assessment and we identified sites which can absorb this technology, and we tried to quickly establish sequencing capacity in those countries. Next, please. And the third is to really network, as I highlighted earlier, all these national labs, regional labs, and specialized networks to be connected to each other and share resources. And most importantly, to create access to sequencing for those countries that do not have sequencing capacity. Next, please. So at Africa CDC, what we are trying to do is trying to close this loop. There are countries with no or limited sequencing capacity. There is a specimen referral, moving specimen from one country to the sequencing lab. So this process is very challenging in Africa because of connectivity, availability of dry ice, several other reasons, import-export permits, and material transfer and regulatory agreements. And once the samples reach to the sequencing lab, we try to support the sequencing labs to have a reasonable turnaround time. The data has to be quickly sent back to the countries so that it can inform the outbreak response. So we support the regional hubs on that, and then data and reporting. The data has to be generated and quickly shared to the countries as well as to the regional and global community so that this data can actually inform design of diagnostics, vaccines, and even shape our response to the pandemic. Next slide, please. So at Africa PGI, we think collaboration is key. That's one of the lessons that we've learned. We need to collaborate at national, regional, and global level. Coordination is very important. We have a much more bigger challenge. So if we come together from the public, private, as well as the philanthropic sectors, bringing all that together into one much more stronger response, it actually helps. And most importantly, to have that commitment. When we try to respond, we are not just responding to the COVID-19 pandemic, but in our design, there's always thinking about the future. How can we use this network beyond COVID-19? How can we use this lab capacity beyond COVID-19? So when we even choose from the choice of the equipment to the choice of the training designs and all that, there is that input, thinking beyond COVID-19. So we're trying to create this platform for that partnership, which can respond to the current pandemic, as well as prepare the continent for the future. And most importantly, next please, we were trying to bring the community together, building a community. So in this summary paper that was published recently in Science, more than 300 authors were involved. And almost all sequencing labs in Africa were part of this. So we're trying to bring the community together so that the sum is, we understood and we learned that the sum is bigger than the individuals. So that's it from my side. Thank you so much for the opportunity. Over.
It's a great story, going from a few thousand to more than 50,000 sequencing. And the greater challenge is having more than 300 authors on a paper. That tells a huge story all the way along. And I think the other part of this, I think to reinforce, is how much time matters and your emphasis on how quickly people can do that work and turn around and to be part of that network, because it's clear that nobody can do this themselves. And I think you highlighted the importance of a regional network is only as strong as each of the nodes. So thank you for that. Let's move to Dr. Howard. You've been, and really now we're going to look at sort of a global perspective as well, that you've been leading an effort to examine lessons learned from other regional centers for disease prevention and control, such as those in Europe and Africa, to support what's been part of the call to action about an Asean Center of Excellence. Interested to get some of your early insights and early recommendations and the opportunities that you see. Thanks.
Thank you very much, and thank you all for being here. Since I am the last speaker and the live speaker, it's nice to know exactly how many minutes I have left to talk. So, as mentioned, we're looking at operationalizing regional infectious disease control cooperation, which is a mouthful in and of itself, but quite important and quite relevant, as you will all agree at the moment. So as we know, this region has experienced numerous epidemics, including the current COVID-19 pandemic, which we're all well aware of since we're all wearing masks inside. These kind of crises highlight the importance of transnational and collective prevention response and the need for regional control efforts. So the Association of Southeast Asian Nations, Asean, is establishing a regional center known as the ASEAN Center for Public Health Emergencies and Emerging Diseases. And in order to help support this, we have been conducting some collaborative research at NUS School of Public Health and with HITAP in Thailand as well, which is funded by the Health System Research Institute. The aim of this research was really to identify and synthesize lessons, because we have heard these wonderful examples thus far, and we really wanted to look at, okay, what are some lessons that we can draw from operationalizing these kind of infectious disease control bodies and networks? So what were the data sources we've used? We first did a scoping literature review, and from that, we were able to extract 59 sources from 9,395 potential sources. And these described 32 regional bodies or networks. We also, secondly, we are currently actually conducting approximately 20 interviews with regional and global experts. And we're hoping that somebody on the panel can actually be interviewed, so look out for an email from me. And also, we have been conducting workshops with regional stakeholders. So I don't know if you can see the quotes, but there were a couple of nice quotes that I just thought I would share with you. The first is really about trust, and that runs through everything we found, is this idea that first you need to establish trust between members, and you need to build on that in order to create any of these bodies that would be then effective. And the second is about having strong leaders, strong leadership from somebody who has the experience, the level of trust and the gravitas to be able to lead a body such as this that covers a whole region. And then finally, and you will see this again and again, funding. Funding needs to be sustainable. The funding cannot just be a project for a couple of years. It's got to be sustainable. So, the key enablers, and you will see that I'm kind of repeating some of the same things, having realistic objectives and clear governance and organizational structures. It just does not work if somebody has a great idea and tries to run with it without having those clear structures in place. Having performance monitoring, not of everything, but of key things. And ensuring that there is training and capacity building of all members, because not all members may be at the same level or may have the same level of understanding of what's happening. Good prioritization, ensuring key priority areas, and again, the trust between members. The challenges, coming back to the same points. Unsustainable funding. If it's project-based funding that lasts a year or so, it just will not do the job. Lack of technical capacity and insufficient technical support is the second key challenge that we found in many, many different areas. And then what can happen is in certain countries there may be conflict, there may be political instability, and that can obviously affect any sort of diplomacy, any sort of working together regionally. So in my last couple of minutes, I'll just touch on some initial lessons learned from this research. It's very important to have a shared vision from all members, so all country members. And an understanding of context. This cannot be imposed externally. This must be contextually based. And collective ownership, which goes along with making sure that it's contextually based, yeah? Clear governance, again. this is obviously important to minimize parallelism, to minimize overlap, and to avoid what tends to happen when you have arguments and conflicts because maybe you didn't quite have the same shared vision. This is where the governance structures come in. So this obviously shows why it's crucial to design from the beginning, plan, monitor, and evaluate from the very, very beginning. This cannot be added on later. This cannot sort of happen ad hoc. It must be planned carefully from the beginning if you actually want success. And the crucial importance of multi-sectoral engagement. This again, obviously we're talking about infectious disease control bodies. So we're focusing on infectious disease control experts and expertise, but this cannot happen in a bubble. This must be intersectional, it must be multi-sectoral. So it must have buy-in from many, many different sectors, many, many different people. It cannot just be us disease experts sitting in a room by ourselves, right? It just doesn't work, and we have to admit that. And back to core funding. It must be sustainable, it must be core funding, and it must be for the long term. It cannot just be project-based funding, all right? So contextualization, multi-sectoral engagement of diverse stakeholders. And those are the initial lessons that we have pulled out, and I will stop here and say thank you very much for listening. Back to you.
Natasha, thanks so much. That was a great summary, and I think that the cascade of discussions really going from what we heard in Thailand to some of the regional networks in Africa to your global view and what it's going to take to put together a center. You know, you would have thought we would rehearse this in the sense that at the end of Michael Bloomberg's, during the interview, he talked about philanthropy and the role of doing the homework. He said, it's not easy to give out your money, but unless you do your homework. So I think that what you've laid out is really terrific because you've done that homework to try to sort of lay out what's going to be needed to establish the characteristics that are going to establish this center in the region. So thank you for doing that. If I could go back to we're going to wrap up here. Go back to the slide of the call to action as we finish. And again, thanks to Dr. Thanat, Sofonias, and Howard for your great insights and the vignettes that you've given us. Individually and together, you've highlighted how scientists are working across institutions nationally, regionally, and globally to address today's pandemic and save lives. And as Dr. Thanat highlighted really at the beginning, that we don't want to lose this opportunity. We don't want to fall into another cycle of panic and neglect where we're interested today, and as we get the pandemic behind us, people move on and forget about the need to build these institutions for the future, particularly the ones we've talked about now, to develop this early warning system where time matters. Time means lives. And so this one, as far as the beginning with the COVID genomics, but thinking more broadly to the range of infectious diseases that we need to get a better handle on as soon as possible. So this is our opportunity to take forward this tremendous innovation and collaboration we've seen among just a handful of the partners, and there are many others. And we're building this future where national scientific capacity, regional coordination, and innovation ensures that we don't have to go through this again. Our panelists shared that we know how, and we have this unique window of opportunity, this political will and a commitment to make that future a reality if we start building it today. Again, I want to thank all the panelists and thank the organizers for having this important session and this call to action, which is a call, but what we really need is action. I want to invite the audience to submit your questions to us, and the team will connect with each of you as a follow-up, and to tell you more about the range of partners and what each of the partners is doing, and how the group assembled here can help to advance this and really so philanthropy can transform this pandemic prevention vision. So thanks to all for your time today, and again to the organizers for putting this important topic on our agenda. Thank you.